Dr. Rubina Mandlik to guide us on practical strategies and pathways for change.
What we've seen is that men do matter in nutrition. However, nutrition and health have traditionally been historically focused towards women, both as the end users as well as the providers. And this has alienated men from the so-called female domain of family planning and nutrition, and thus has reinforced the imbalanced gender roles that we have. So we are well aware that men influence food purchases, they influence child feeding, healthcare decisions, and there have been several studies in India and other low income and middle income countries that have shown that engaging men improves family nutrition and health outcomes. Now, I'll take you through 3 levels of engagement. So we start off with household actions that men can take to practically engage with nutrition and health domains. So they can function by supporting mothers with breastfeeding, by helping them with their chores, and by providing emotional support. They can share in decisions related to food and health. Um, they can participate in child feeding and meal preparation, and also encourage family meals with nutritious foods to set a positive example for their children. Now, in a lot of the work that we've done, we've been able to come across this where men have a lot of influence on what their children eat. Because during one of our focus group discussions, we had this grandmother who told us that the grandchild only eats egg when the father sits down and eats it. And then there was another example where a mother said that her husband enjoyed eating snacky foods like chaklis, etc., along with his meals. So whenever he sat down to eat, she had to send her little baby out along with his other siblings so that he wouldn't be led to eat these foods as his father does it. So she has to be bothered about his nutrition, but she also has to take care of her husband's requirements and whatever he needs, which made it a great burden for her to ensure that her child eats well. And it's in this area that men, when made aware, can be a very strong positive influence on how their children choose food. Saroj, you'll have to move to slide number 4 now. Yeah. So we are coming to our second level of community actions. Community actions can be had in the form of peer engagements. And I think peer engagements are best had in spaces that men are comfortable with. For example, in their workplace, probably at the chai ki tapri, maybe at popular male hangouts. In a rural area, it could be farmer groups. Community engagement can be in the form of champions and role models at the local level. Of course, schools and self-help groups can be very good engagement platforms, and a fostering of couple activities, especially during festivals, like there's a very common practice in Maharashtra where the women and the men, they do what is called ukhana. Ukhana means they have these small couplets that they write, and they use that to take their husband's name, because traditionally women don't call their husbands by their name. So it's through activities like this which individuals can culturally relate to. It's using activities like this that you can send across messages of nutrition and health awareness. Now we come to our next slide of system actions. And I think over here, one of the important points that was raised by the rest of the speakers as well was having male volunteers in Poshan programs. As we are well aware, majority of our frontline workers are females, but it would definitely help to have a male volunteer and a male role model who can engage with men on their level and in their comfort zone. Additionally, mass media and social media campaigns, these can be used as important ways to engage with men, especially if there are effective ads that are relevant to the local population and are aired during prime TV time. Workplace policies that support shared caregiving. So at systems level, this is a major supporter and a motivator to men, so that Workplace policies could be in the form of paid leaves so that the fathers can accompany the family either for maternal health care utilization, for child immunization, and related needs. This brings us to the next slide, behavior change approaches. And I think I would first like to stress upon what Alka ma'am spoke about, and that is having an intergenerational approach. So we don't just deal with one or the other individual um, in silos or separately. I think the best behavior change approach to deal with or to work towards including men in nutrition is an approach that targets all three aspects or the whole family unit. So it's not just the men, it's not just the women, it is also the parents of that adult couple as well as children if they are there. What happens when you do this is, I believe that, and through a lot of the work that we've done in our institute, we've seen that it helps to start working with children early. We talk about working with adolescents, but I think even that stage is a little too late. Uh, when you start working with children, and they are a very good captive population when they are in school, that's a very nice age where they can be easily molded to be able to understand what um, decision making or shared decision making looks like. Additionally, the parents of that couple need to be engaged because, as speakers before me have said, they can be the ones who are resistant to these changes due to previous experiences and expected traditional rules. Um, a suitable place and a time is paramount when you are engaging with men. From our experience, we found that we tried to assess height and weights of fathers, and it was one of the most difficult things to do because they just wouldn't come to the center. We were not able to find them even if we went to their houses because they were working. So it meant that my team had to go early in the morning or in the evening, if not that, then on a Saturday to be able to collect their anthropometric measurements. So it's very important that we find a time that is very suitable for adult men. And this generally happens to be evenings or the weekends. Schools are a very powerful platform again, and influencing children early is very essential. Um, then we come to gender transformative messaging. I think it's essential to use the traditional rules that have been accepted because if you challenge them a little too much, it will lead to a lot of resistance. So instead of that, building upon those traditional roles, for example, you have the traditional role of a man being a protector role. So you reframe this protector role for the man to be able to and tell the man that he is expected to be the protector of his family, protector of the health of his family, protector of the nutritional status of his family, protecting his family from becoming sick. This is what the protector role can now encompass. Um, Once again, reiterating, you individuals need to be engaged early. Once they are married, it's a little too late for engagement. Not like it's the wrong form of engagement, but I think best engagement happens before habits and um, roles have been formally fixed in behaviors. We find that a lot of content is easily taken up if it is delivered in locally relatable format. For example, we ran a series of social behavior change communication sessions. We used what is called Pravachankars in Maharashtra to be able to deliver this message. So they delivered pravachans, and through those pravachans, talked about health and addictions. And we found that a lot of our uh, cohort participants were very interested, and we always had a full session whenever the Maharaj was delivering the sermon. Um, yes, another important thing is that when you are working with teachers, when you're working in schools, it's very important that the teachers are equipped to deliver gender transformative messages. I remember when I was doing my PhD um, in the school, the teachers would call the students after they were done with their lunch to sweep the area where they had their lunch. Now, that itself is not acceptable. But what was further unacceptable is that they didn't call all the children. They only looked for the girls to come and sweep up the area where they were eating. So if we want to deliver gender transformative messages, it needs to start with teachers being equipped to deliver such messages. Saroj, can you please go to the next slide? Yes. So currently, we see that men are seen at two extremes, either as decision makers to be served or as occasional helpers. And our goal is to be able to move beyond this spectrum to engage men as true partners and supporters in the family nutrition. For this, it is essential that we need to help men unlearn some traditional roles and build skills and mindsets for shared caregiving. And this requires an intergenerational approach. Saroj, the next slide. And a shift across generation requires one, demonstrating shared decision making and gender inclusive life skills to children early in schools. It requires supporting men to take on partnership roles in caregiving and nutrition. And it requires engaging parents of adults who may struggle with changes to the traditional gender roles. So, Roj, the next slide. Yeah. So, effective engagement, like I said, and reiterating, is required at the household, community, and the systemic level. And for sustained behavior change, the choice of place and time of engagement, reframing of gender norms to become transformative, and role models and local content will be something that you will find very useful um, when you go about designing interventions in this area.